All right, well, welcome everyone. Thank you so much for coming to our first annual speaker series. We are so excited to have Rachel Walter with us here today. She is, sorry, she works at Lee Health as the community programs coordinator with community fairs. She specializes in community outreach and health disparities throughout the Southwest Florida region. Rachel received both her bachelor's and master's degree at FGCU, earning a BS in biology and political science in 2017. And an MA in environmental studies in 2019. As an FGCU student, Rachel is best known for her 6-year leadership role with the Global Medical Brigades as a student-led organization that provided health services to rural residents of Central America. Rachel continues to serve the FGCU community by serving as an adjunct faculty member within the FGCU Honors College, where she teaches a course about the health disparities in Southwest Florida. Rachel is also just like #1 hero in my book. I absolutely love her. Her jokes are amazing. She's so funny, but she's amazing and talented at what she does. So we're so excited to have her as our first community speaker. And we can't wait to hear what you have today. So thanks so much for coming.
Thank you very much. Oh my goodness, I'm so excited to hear that I'm the first, the speaker series. Oh my gosh, what an honor. Yes, thank you to the Office of Service Learning for hosting me today. I've certainly had a wonderful experience at FGCU and in Southwest Florida, and I'm excited to share some of that story with you all today. Special shout outs in the audience. I have some of my community affairs Lee Health colleagues here. Lauren Ware, Karen Krieger, and Kim Gade, I believe, are in the room. I also have my very best friend, Amanda McCarthy. And I think my parents are here, Michelle and Dave Walter, and even Wayne Walter, my brother. So I'm very happy. I have some very special people in the room, and they are certainly aware of the story, but I'm sure that they are not going to mind hearing it again. Otherwise, they wouldn't be here. So a little bit about me. I did do both of my master's and both my bachelor's and master's degrees at FGCU. I'm a double eagle. Right after my bachelor's in biology and political science, I quickly went into my environmental studies master's degree where I worked closely with Jesse actually. And that was a really great time. I enjoyed both of those programs very much. Currently, I am the coordinator of our community programs coordinator at Lee Health within the Community Affairs Department. And I mainly specialize on things like health disparities and community health assessments. So my main areas of interest include the healthcare access, social determinants of health, underrepresented populations, and health equity. And these are all things that I have learned throughout my journey. I certainly didn't start out with that. In fact, I'm going to share with you a brief timeline, but I'd like to share with you the first one in 2012, quote, "I'm going to be a trauma surgeon." Spoiler alert, that does not happen. So as a 16-year-old person, I entered FGCU through the FGCU ACE program, which is a dual enrollment program that allows students to come to FGCU full time in their high school career, and I did that for both my 11th and 12th grade year. So subsequently, I went on Yahoo Answers and totally chose my major based off of a stranger's advice that I should choose a biology major, and it was fine. I stuck with it the whole time, but clearly something changed along the way, and that's kind of the point of the story. So 2013 was my first time going on the Global Medical Brigades trip. I was connected with a really fantastic honors mentor who was the president of the group at the time, and he inspired me to join along and go to this trip to Central America, which my parents were certainly not happy about, but of course supported me along the way. Be careful, please. 2016 is really when I realized the connection between environmental health and human health. And this was the turning point where I was like, oh, I don't know if I necessarily want to do the trauma surgeon thing anymore, but I'll keep that biology degree. That's okay. 2018, I linked up with 2 faculty members at FGCU in the public health and social work departments, and them knowing my history with the Global Medical Brigades, they asked me to come help them on this research, health screening, and health education research project. And it was a really great experience, but certainly some culture shock there that I'll share with you later. And then 2019, I was very, very bold and decided to message the lady with my dream job at Lee Health on LinkedIn. I said, hey, like, this is my story. I'd love to hear your story. And I was very bold in asking her for some professional mentorship through the LinkedIn DMs. So obviously, like that went well. We met for Starbucks, and that's my current job. So very happy with the way that turned out. And then that brings us to pretty much today, 2020, the infamous 2020, which is a really interesting but also terrible time to be in public health. It's a weird time to be in love with the public health profession. In 2020, two really huge public health crises, our COVID-19 pandemic and systemic racism, kind of took center stage. And so lots of stuff going on, but I'm going to kind of walk you through the timeline. And first we'll talk about my favorite thing in the world is global medical brigades. So I did this 5 times, this trip. These are group photos from a different trip each time. You can see kind of how we grew over time. We get a larger amount of students involved at the end. And if you don't know, I'm right here, I am right here, I'm here, and I'm here. Just look for the shortest person, and that's probably me. So the Global Medical Brigades experience was all about bringing the access of healthcare services to rural areas where they don't have access. So this for us was like the rural mountains in Nicaragua and Panama. And when I say no access, it means that we were talking to people that had never seen a doctor before. And that gives me goosebumps every single time I think about it. But you can tell the magnitude of the experience just from that. Pretty much what we would do is go in and set up some pop-up clinics and when I say pop-up, I truly do mean that, in like a local school or a church. And we would be like, this room would be good for doctor consultation, this room would be good for dental. And so we'd kind of have to quickly maneuver the resources that we had in order to provide a good clinic experience. And these clinics were packed. So well attended. We saw at least 1,000 patients in 3 days. It was absolutely just amazing. And we had like 4 stations available throughout the clinic. So we had our first one was triage. So obviously the patient comes in and tells us their name, their chief complaint, like, oh, I have back pain, my baby can't stop crying. And then we send them to the medical consultation where they meet with a doctor on staff. They talk with the doctor, they have plenty of time to talk with this doctor. And then us as the student volunteers, we would kind of sit next to the doctor, and sometimes we'd have the chance to weigh in and make it like an educated guess about what we think their diagnosis would be. And that was a good learning experience. And then the patient would walk away with a prescription for any kind of medication, any kind of, extra thing that they had to do, maybe like a physical therapy exercise, like make sure you do this 100 times a day. I don't know, something like that. And then they would go to the pharmacy. And the pharmacy is where I spent the entire time each trip. So, and I'm kind of smiling about this because it was so chaotic. The pharmacy was the most chaotic place to be. First of all, we don't have like nice racks of prescription drugs. We were working out of suitcases and trash bags. So of course we're like, right, like we're totally not organized, and we're just like, oh, I found the Advil and doing things like that. Add on to that the fast pace, right? Like we're trying to fill prescriptions like now. We have the prescription in our hands. However, it is written in Spanish and also hieroglyphics. So now we have to figure out what the heck this piece of paper says, and then figure out what it is in Spanish, then try to translate in our head, what does that mean? And then go find it and fill the prescription. And then of course we have to go tell the patient all of the things that we learned about these drugs. Hey, take 12 of these over the next 2 weeks, whatever it was. And so very chaotic. And then our last station was a Charla station, which was basically a health education. And this was certainly optional, but a lot of this was very well attended. Adults would take their kids to learn about cavities. You need to brush your teeth. You need to, stay away from Coca-Cola and high sugar food and drink. And it was always like absolutely new. It was new information, right? Like this was all totally new information to them, which was interesting, but also very sad. So I remember a turning point in this situation. So remember, I wanted to be a trauma surgeon. Somewhere along the way, I was like, I don't know. And so this is that story. So this was typically what the environment looked like. So on the left here is a picture of what a typical Central American rural neighborhood community would look like. It's very run down, dilapidated, like, you know, at home here we have garbage services. Waste Pro will come through. Okay, they don't have Waste Pro going through their community picking up their trash, but it has to go away. So what do? We burn it. Right? And so some of you are ahead of me. When you burn trash, that comes with several very negative effects, right? Like imagine a Cheetos bag, you put it in the fire, burn it. Now you're burning plastic, carcinogens in the air, you're breathing in the air. That's not good for air quality. That might be going into your groundwater. Just overall not a good situation. And then, of course, the thing at the top is albendazole. So this is really the entire turning point for me. At one point, in one of our clinics, the staff doctor came into the pharmacy and said, "Hey, from now on, everybody, just put an albendazole packet in every single one of the prescription bags." And we were kind of like, whatever, we're moving so fast. We're like, "Yep, we got it, doc. Like, thanks." And so we're filling the bags. Albendazole, if you don't know, is an antiparasitic drug. So what the story is behind that is that the doctor kind of realized that all of the patients that we were seeing were coming in and complaining of stomach ache, loss of appetite, dehydration, and all of those are very consistent with parasitic diseases. And we can deduce from that community and the condition that it was in, that it was because of their poor water quality. So these people did not have taps in their homes. Some of them didn't even have floors. They just like lived in the dirt. And so they were consuming water that was dirty and causing all kinds of health problems. And so albendazole kind of treats that. It'll reduce the effects of the parasitic disease. So that was interesting because now we've added albendazole to all of these prescription packets, just knowing in our brains, this is because of a water quality issue. Well, I remember going back, so in the middle of the clinic, we don't have time to like think about, I wonder why exactly we're doing this. There was just simply no time. But later that evening, I remember talking to a few other students and I said, I kind of feel weird about that albendazole thing. And everyone's kind of like, okay. And I'm like, doesn't it seem weird that we're not going to talk about the water quality and we're just going to make sure that they don't have a tummy ache anymore? Like, isn't that kind of not solving the problem? And so as a group, we kind of deduced that we needed to do something more. And we came up with a plan to talk to the community members about it the next day. And we talked to them and we're like, hey, like, what is the problem with the water quality? What do you think is the issue? And they started telling us, like, listing off all these problems. They're like, well, the well, it doesn't really work. Like half the time it doesn't work. It's corroded. Most of the time we don't even get to use the well. We have to go to a river and like get the water out of there. And we don't boil it. And I was just like, oh, okay. So like, this is truly the problem that we need to be solving, but certainly no one would think that, like, that's kind of a harder problem to solve than giving someone albendazole. So the solution was our team decided to dig them a new water system. So, and I get goosebumps and I almost want to cry just thinking about it, but this image on the left is our team hiking up and digging a mile-long trench to lay a new water pipe and install a new water filtration system for this community. On the right here, you see those little boys playing with the new well system that we just installed in their community. And hey, no more need for albendazole. Like, we fixed the problem, right? Like, of course we need to do the albendazole. We need things like that to be able to say, you know, like, okay, like, let's give you the albendazole and then we'll figure out like how to fix the water quality. But that should never be the last step, is the albendazole. That's wrong. So it was from there. I have goosebumps all over talking about this. At this point, I was kind of like, okay, I don't think I want to do the trauma surgeon thing anymore. I kind of want to zoom out a little bit and look at what are those things that are causing the true problems. And right, so now I go home. Okay, so I go home after this trip. My house is the one on the left here. And I remember my dad is on the line, and I remember him saying to me, just in passing, he just made a comment like, the houses are so close together. And I don't know why, but that totally has just stuck with me. And I brought it back to one of my faculty members at FGCU in my classes. And I said, hey, like, do you think there could be water quality issues if the houses are too close together and they're both using well water and septic tanks? Like, is that an issue? Like, could there be like cross-contamination? And my faculty mentor was like, I love that you just said that, and explained this whole thing to me. So this is kind of an annoying graphic. I'll get through it quickly. But just think about if the homes are 10 to 20 feet apart, right? And then they all share the same ground. We have property lines, but the water doesn't know that. We have septic tanks and we use wells. Oh, speak of the, it's my faculty mentor joining. So if we have these homes that are 10 to 20 feet apart, and they're also using septic tanks and they're using wells to draw up the groundwater, what perhaps is the problem with the septic tank leaking and perhaps contaminating that groundwater? So at that point, you might be drawing up groundwater into your well to drink, to water your plants, to fill your pool, whatever you're doing with it. That's an issue because what goes in a septic tank? It's sorry to be crass, it's human waste, and you don't want those things in your water supply. So the question was, and this ended up turning into an honors college thesis, which I'm very proud of. This ended up being a thesis project where we asked the question, is there evidence of human influence in the well water in Southwest Florida? I'll remind you, this is 10 minutes away from FGCU. And so what do we find but Splenda? Okay, so this is very interesting because it's kind of like a mind trick. Unless I went up to your well water and opened packets of Splenda and started pouring them into your well water, there is no reason that Splenda should exist in your well water. It's not natural. It doesn't occur on a plant, right? So that means that probably got there from your septic tank leaching into your groundwater and being drawn up through your well. That's nuts, right? And so I certainly, there's limited literature on this. They're called chemicals of emerging concern because they're emerging concerns. And so no need for alarm. But this is a growing thing that we need to pay attention to. How do we see human influence in our water bodies? And of course, this has extreme relevance to our current events, especially in coastal Florida. We deal with red tide nearly every year or more. And we certainly don't look at red tide and the algal blooms and say, oh, well, like too bad for the water. No, because it has severe health effects. And we know this, there's health alert signs along the coast. From Florida Department of Health, and it says, don't swim near dead fish at this location, right? And then it also says, if you have chronic respiratory problems, probably don't be around here, okay? Because we know that the health effects of the algal blooms and the water quality severely impact your health. So that it's just kind of like another testament to how much it connects. So kind of a different page here, but while I'm working on my master's degree, I'm approached by two faculty members that I'm very familiar with, and they say, hey, we're starting this project in Immokalee. After Hurricane Irma, the Immokalee residents were having a rough time, coming back due to documentation status, health literacy, general literacy, all of these different things. And they asked me to come set up their clinic flow. And that's my jam. I love that. So I was like, yes, of course, I'll help you. And it was a really successful project. It's actually published. It was published last year as a research paper. And that's really, really cool. You'll see on the left here, my friend Karina is giving a health education seminar about chronic diseases. And on the right here, we have some students taking blood pressures and working on the questionnaires that we needed for the survey. Quick thing about the survey, and this is kind of the biggest culture shock moment of my entire career. I remember preparing for this research project and saying, hey, did you guys put the questionnaire, the survey in Spanish? Very easy to understand why I asked that. Immokalee is predominantly Spanish speaking. We want to make sure that it's in their language. And they're like, yeah, we got it, we're good. And so I'm like, sweet. I remember the first day of the clinic, the first man that walked in, I handed him a clipboard. Hello, welcome to our clinic. Please fill out this questionnaire and we'll be with you in one moment. And he takes it from me, looks at it, and promptly gives it right back to me and says, I can't. And I was like, okay, no problem. taking it as like, he cannot read. I understand. I gotcha. We'll talk it through. So I sit down with this man and, we're talking about this questionnaire, and there's some sensitive questions on there. There's like, what's your documentation status? And he certainly doesn't want to tell me, like, he doesn't know who I am. But, connecting with that person for 15 minutes really does wonders for how that person trusts you. And that was kind of the point, is trust. And so he eventually got around to, opening up and being like, yeah, like I'm undocumented, and like, here's all my information. This is what happened to me with Hurricane Irma. I lost my house and all of these different things. And so I'm filling out the questionnaire. I'm like, okay, great. I do need you to sign the bottom of this paper though, just to certify that this is correct information. He looks at me and says, I can't. And that to me was the biggest moment where I was just like, oh my gosh, not only is it literacy, he's not confident in his ability to write enough to write his own name. And that was a really extreme experience for me. One, think about going to Central America for 6 years and, doing all these clinics, and then realizing that just 20 minutes away, it's the same exact thing. Whoa, that's such a heavy thing on my heart. I have goosebumps, want to cry about it all the time. This is a huge thing. It is a very, very different experience to be in your country and go outside of your country, and you're like, I have resources. I'm an American. I have resources. I will go help this country that's struggling. And then to come back to realize that it's the same in some places. That was the real culture shock for me. And so from that experience, I really was hard set on community outreach as my career. I was like, this is what I want to do. I love connecting with people and learning about their experiences. The other experiences are so interesting to me. My mom and dad are on the line today, and so is my brother. I always love to say that I had the best childhood ever. I had like all of the resources, all of the support. I had everything. And so learning about what it's like to not have those things is very interesting to me, because I do not take for granted all the things that I've had, especially just thinking about like simple things like health, right? I've never had to worry about it. The personal story, just recently, I went to just last year, I went to the doctor, and they told me, they're like, hey, you're obese. And I was like, oh, wow. And I truly didn't care. I didn't really understand the gravity of what that word was until the next day it showed up on my medical chart as a chronic condition. Then I was like, ooh, I don't want that to be on my medical chart. Okay, so I quickly realized that I knew exactly what I needed to do. I need to count my calories. I need to join a gym. I need to do this, and this. Okay. Just thinking about all the things I had to do, I had to afford a $150 a month gym membership. Of course, there's cheaper ones, but this is the one I liked. I had to get a smartphone app and know how to use it and count my calories. I had to continue with the support. I had unlimited support from my friends and family. They were always checking in on me. Let's see the progress pics and all of that. And I am no longer obese. Happy news. But when you think about that, you need access to transportation. First of all, you need to go see a doctor in the first place to get that news. You need to have access to a smartphone to do the calorie counting efficiently. You need to have the money for a gym. You have to have a car to get to the gym. You have to have all of these things. And those are little things that I think maybe we all take for granted a little bit of the time. Just simply driving to work. What if you didn't have a car? Then you can't, you have a hard time getting to work. So anyway, I think this was a really big experience. This Immokalee Latino Health Project was a really big experience for me to bring it all back home. It's very easy to leave home into a different country and be like, whoa, that was crazy. But then when it's here at home, it's a little bit harder to escape. So when I think about my journey so far, I actually really like to think of this analogy of kind of a river. Imagine that you're walking alongside the river and you see somebody flailing around in the water drowning, and you're like, oh my God. And you jump in and you save this guy, you pull him out, and you're like, hey man, be careful, don't do that again, okay? You're like, geez. And you keep walking. Now you see another person drowning, flailing, and you jump in, save that person. Then you see another person drowning, you jump in, save that person. At what point do you turn around and say, who the heck is throwing these people in the water? right? And that like that's exactly what happened to me with the albendazole thing, right? I'm like handing out all these tablets. You get Advil, you get Advil. And then all of a sudden I'm like, hold on, why are we giving out so much Advil? Who is doing this? Like, what's happening? Right? And we know these things, like the secret culprits in health that I found to be were the social determinants of health. And in public health, we love to be really straightforward about things. So when we say social determinants of health, it's truly the social factors that determine your health. And so these are things like, if you think about my fitness story, right? Like transportation options, access to care, community design. Do you have a safe neighborhood where you're able to go exercise outside? I live in a fine neighborhood, but I'm embarrassed to go exercise outside. So that's a different problem. Being able to afford quality food. If you look at several low-income neighborhoods, this is a family tradition for us, I think now, a family game when we're on vacation. We drive through neighborhoods and try to count how many grocery stores there are. And you can tell where the poverty is by how many grocery stores are not in that neighborhood. Very interesting, fun academic game we have in my family. Environmental quality, access to educational opportunity, and a job that has livable wages. All things that are very, very important. Something I really like about this graphic is that health equity and resiliency are on the inside. So health equity means that everybody is kind of experiencing the same thing. Everybody has an opportunity for all of these things. Resiliency, as we know, is the ability to bounce back when something happens. I love this so much because imagine if you don't have a few of these things, and like we know, like stuff happens. Example, COVID-19 happens, right? You lose your job, you can't pay your rent. Now you have a chronic condition and you're afraid to go outside to the grocery store, and like all of these things, right? Resiliency, you need to have all of the full support of all of these factors and to be able to bounce back. Another family example I love to use, I've totally grown up in a soccer family. As much as I like truly don't even care about the sport, I think in terms of soccer almost 100% of the time. So let's pretend that our health is the tan team, the team on the top. And then we have two ominous red dots that are obviously our opponents. And the biggest opponents to health, we know, are disease and poverty, right? Like we know those are the bad guys and they're trying to score on our goal, which is protected by the thing that we blame the most when disease and poverty kind of transpire. You might be thinking of things, but the thing that I think of the most is the healthcare system. We love to blame the healthcare system if disease or poverty goes wrong. Think of COVID, right? We're like, those, and we're not necessarily doctors, right? Like we appreciate the doctors sometimes, but we're like, yeah, but the insurance, the cost, the access, we love to like blame that little group of things. And I agree. However, if you have ever played on a soccer team or any kind of sports team and blamed one person on the team for something that happens, there's always the coach or always a parent that says, hey, it had to go through everybody else before it got to that last line of defense, so it is not that person's fault. And that's a personal experience that I've had for blaming the goalie when things go wrong. But we know that there's different things, and we know that we have lines of defense. Who are our players? It's all those things we saw previously: safe housing, food security, environmental factors, employment, income, all of these things, right? So we know that all of these things play a huge role, but the key is that they all have to be there, right? If like two are on the bench, oh, we're down a player, it's a power play, this is not good, they're going to score on our goal. For example, imagine we remove access and environmental. So you're living in terrible environmental conditions and you lost your healthcare access. Okay, very clear what's going to happen here. Poverty can make a run right down the side and is going to be has a much easier time scoring on the goal, and poverty will transpire. So this is a really interesting example of all of the players on the team need to be there, right? Like you can't just have safe housing and then nothing else and you're like, I'm cool. No. Like you truly have to have all of it enabled to be able to have that resiliency and that equity. So long story, but also sad story. So what are we doing about all of these things that we obviously need to have in our life to promote good health, but also prevent bad health? We want to do both of them. We don't want to do just prevention because that's not it. We want to also be healthy. So we have things over here on the left side. This is the socio-ecological model in public health. We have the individual and interpersonal levels. These are things like, what's your support system and what are your internal values? Are you aware of your rights? What do you know? Like, what's your religion? How is your religion like driving your actual behaviors that determine your health? Then we have things like organizational, your school, healthcare system, workplace. Great example is FGCU. If you go to school at FGCU, you have an abundance of resources. You have mental health services, you have student health services, you have fitness facilities, you have like a freshman resort with like 8 pools or something, and you have dining facilities, fitness facilities, you have all of them, all of the things. And so that's a really important piece of your external environment that will determine your health. Community, this is my favorite one. I love using the faith community as an example, churches and other houses of worship. If you don't have some access, or you're struggling getting access to food, there's so many examples where the church is there for you. Like, the church is there for you. It steps in and you have that community of faith behind you. Another good one is childcare. Childcare, like the church has childcare camps all the time. And so that's a really good example. Another favorite of mine is the marketing piece. You might be saying, like, what the heck does marketing have to do with this? Marketing, like the social marketing, so not social media marketing, but social marketing, the marketing that you may or may not know, it might be unconscious, but it's really driving your behaviors. So I think of 2 really easy examples, and these make me laugh every single time, although maybe they're not funny. I think they are. Remember the commercial where they have a hot frying pan and an egg, and they're like, this is your brain, the egg, and then they crack the egg into the frying pan, and they're like, this is your brain on drugs, right? And so you as the consumer are supposed to be like, oh my God, I don't want my brain to be a fried egg, right? So you're like, I'm not going to do drugs. The other one that I always think of, and this one just makes me laugh so hard, is the one where that girl, she looks like she was put through a taffy puller in like Willy Wonka Chocolate Factory, and she like sitting on the couch, and then her friends are like, hey Amy, do you want to come play? And apparently she can't respond because she's like high as a kite and like smoked way too much marijuana. I don't understand why she like flattened out, but she's like a flat person, and she like couldn't participate with her friends because she was high as a kite. Oh my gosh, hilarious. But also it was kind of like, you're going to be excluded from your friend group if you do drugs. And then, like, as the consumer, I guess you're supposed to be like, oh my gosh, I'm never going to do drugs. But for me, I was like, what happened to her body? But anyway, and then you have the final stage, which is the public policy. So that's government, your laws and policies. And as much as like government does so much for health, if you think of like really small examples, it doesn't have to be things like Medicare or Medicaid. Like, certainly those are some, but some that I like to think about are things about like the car, right? So laws and policies, they tell us things that we must do and things that we cannot do, right? And so things that we must do, you must wear a seatbelt. Okay. Things that we may not do, you may not drink and drive. Okay. And so like these things drive our health behaviors. Like this is obviously related to health, right? Like we have to have our seatbelt on, and then we don't want to be drinking and driving because you're probably going to hurt yourself or others. So I love this model. I think it's really cool. It's kind of the spectrum of prevention. And so I want to talk a little bit about the community portion of that model. So I usually talk about this when I'm talking about healthcare classes. I'll breeze through it for you. The Affordable Care Act, it was a comprehensive healthcare reform law enacted in 2010. It essentially said that as American citizens, like, you have to have health insurance, okay? And I know this is a controversial topic, so whether you agree that it's a good or bad thing, it also did something really wonderful for nonprofit hospitals. As a nonprofit hospital, you don't have to pay taxes. That's kind of the point. You're tax exempt. But the Affordable Care Act says, hey, if you're not going to pay any taxes, you need to show me, the government, that you are providing some kind of benefit to your community. How are you helping your community if we're going to give you this massive tax break? Okay, because they are massive. So this reform law basically said, show us what you're doing for your community in exchange for that. And that kind of encompasses the community benefit rules. So in order to properly provide any kind of service to your community, you need to know what your community needs. You can't just go out there and provide, hey, here's a bunch of tomato plants, and then your community's like, why the heck are we dealing with all these tomato plants, right? Like, it doesn't make any sense. So part of this legislation, the Affordable Care Act says, hey, every 3 years, you guys need to do a community health needs assessment to look at the needs of your community and see what you could do. From here, you need to develop a plan to implement strategies that's going to help your health needs, right? So just in Lee County, we know that mental health and substance abuse are huge priorities, probably 1 and 2 for us. And so we know where we want to prioritize our outreach services. And so all of the activities that we do make up community outreach. So using those CHNA results, our hospitals, we deploy staff directly into the community to provide certain services. And so these are things like health education, health screenings, referrals, all of these different kinds of things. So another part of the thing, a part of my role is to address health disparities. These are huge, huge deals and are taking center stage, especially amid COVID-19 right now. But health disparities basically means that there's a huge difference in what one group is getting based compared to another group, and they're negatively affected by certain diseases. So this is a great graphic. I absolutely love this. We always hear equal rights, like everyone's screaming equality. Equality is great, but we need to set it up first. So this is a great example because it shows all of these people want to participate in a bike ride at the top, right? And so we have this woman that uses a wheelchair on the left, and she's obviously not able to participate. We have the man struggling because he's so tall on the bike. It's not a bike that's sized for him. The woman next to him seems to be doing just fine, maybe Goldilocks just right. And then the child on the right is obviously his chin is on the handlebars. He's gonna get an injury. So this is the kind of thing when we say, hey, everybody gets a bike, right? Or everybody, we'll give everybody the same exact thing. That's exactly what's happening. Everybody has the same bike. What's the problem? That's fair. Wrong. We don't actually want equality. We want equity, right? So we can see the differences that this woman that uses a wheelchair can obviously participate now. This man next to her has a taller bike, so he's able to participate. This woman, Goldilocks, is doing just fine. No need. And then the little child has a smaller bike, so he can participate and he's not going to get an injury. So the difference is that equality says everybody gets the same thing. Equity says everybody can participate. That is the goal. We do not want to give everybody the same thing. That's a huge waste of money, resources. That's that's crap. It's important for us to think about participation. What does everybody need in order to participate and have the same opportunity to succeed? That is the goal. So as a part of our Lee Health community outreach, our community benefit, we release an annual community benefit report. This is our 2019 numbers. I believe our 2020 numbers were just approved today, but out of an abundance of caution, I'm going to be using the 2019 numbers. So I show you this to show you the value of all of our services. So you really only have to pay attention to this green column right here. The rest of the stuff is organized by our hospitals, our individual facilities, not really that important. But let's just look at the first three: cost of charity care, unpaid Medicaid, and unpaid Medicare. So these are things where people can't afford their care. Right? So as a public safety net hospital, Lee Health will not turn anybody away based on their ability to pay. That's amazing. So if someone comes in with, no ability to pay, no insurance, Lee Health says, it's okay, we'll eat it, right? And so they eat that cost, okay? So that's about a $70 million a year value, just from, helping people that don't have the ability to pay. And then we have things like the cost of unpaid Medicaid and Medicare. So these are people with the insurance plans. They pay a portion of your medical bill, but not all of it, most of the time. And so for example, if your insurance paid 80% of the bill and they said, okay, you pay the 20% and you still can't pay the 20%, don't worry, Lee Health will eat that too, and we'll just apply it to our community benefit investment. I would love to show you that the total value of these three categories is $461 million in 1 year. That's incredible. And that's not to say, oh, Lee Health, you're doing such an amazing job. That's actually a really big indicator of the need for health access in our community. We should not be spending that much money or eating that cost. It should be more affordable, right? Like that's the whole point. So it's not like, hey, Lee Health, great job for being wonderful. It's also, we need to improve the healthcare access and affordability that we have in this country. So the next thing I'd like to point out is the cost of providing community benefit and outreach. This is $70 million. These are all the things that our staff are actually doing in the community. So community health, screenings, education, referrals. We have donations. We sponsor nonprofit organizations in the community that do wonderful work already. We want to empower them. This also includes our Lee Community Healthcare sliding scale clinics. Really wonderful clinic that provides those health services that are so needed, but at a cost that is affordable based on their income. So that grand total is $531.5 million. So that's an immense amount of money. My favorite thing about this is the benefit of taxes. So that number right below that popped out number, that $77 million, that's what Lee Health would pay in taxes if it was for profit. The funny thing about this is that we provide a benefit to the community that's about 7 times what our tax exempt status is worth. So I think that tells the tale. I don't really need to say much about that. I think that's just an astronomical amount of money. I show you this to show you the value of the outreach that Lee Health and their community partners are doing, but also to say that your community outreach, your service learning hours has actual value, right? So I think it's really easy to get bogged down in, oh, I have to do 80 hours. I have to do X amount of hours. I have to do all of these things. No, like it has total value. Your time has value, your expertise has value, and your compassion has value. And it's so hard to calculate. Like, we're certainly not going to try to calculate compassion. How do you do that? But all of those little things, they really add up to the value that you're providing to your community. So whether it is your service learning hours, your internship, your job, your research project, your class project, anything, recognize that your time and your expertise and your compassion all have value in the community directly. And we don't run reports like this individually, right? Like, we're not like, oh, I got to file my taxes, got to run my community benefit report. But if you think about it in this way, it's a huge, huge thing that you're doing for your community. So I'm super passionate about service learning, so much so that I have made it my career and plan to keep it that way. So I'm very excited to show you all the things that we're doing at Lee Health. I think it's really cool. So I have a few words of advice before I leave. Find who is throwing people in the river and stop them, right? So this is the most important thing I can say. You got to find the person who's throwing people in the river. And to use my example of albendazole, right? That's exactly where I went. I was like, who the heck is throwing these people in the water? It was their water quality. So we addressed that. I completely put a stop to that with my band of like 40 students. It was awesome. And this applies to like any problem solving, venture that you're on. You always want to find the root cause of the problem, right? If you have a leak in your house, you're not going to like slap like Flex Seal on it. I guess maybe you would, but right, you're not going to slap it on and just be like, well, it'll be fine. Like it's probably fine. Like, you're certainly not going to do that. You'll always go that extra mile. Consider that in everything that you do. It's so important. Second one, read books. This is an introvert's secret. You can learn a lot about people's experiences just by reading their writing. Like, especially during COVID, where you don't have the opportunity to connect with people as easily as before, reading books has never been so important. And I truly mean that it could be any book. Like, I truly don't care what it is. Read a magazine. I don't care at all. But try to read. It sharpens your mind. It helps your vocabulary. You solve problems faster because you're like, oh, that thing I read. And you never know what's going to trigger something in your mind. So do that. It's important. Know your brand and your value. This is something I have to remind myself of all the time. Your brand is what people say about you when you're not in the room. And hopefully it's good. But you have control over that, which is good. If you know that you want your brand to be courageous, bold, make sure you deliver on that in the room, right? So you have to make sure that you're delivering on those things. And your value is your strengths. What do you bring to the table? What are you good at? What do you provide? Knowing your strengths and your brand is helpful because it will not only build you as a person, but it will help you work on a team because you know your strengths, you know where you're not so good, right? So you're like, oh, I'm not gonna do that part. And it'll help you solve problems way more strategically, way better, and just efficiently. And then my last thing is be bold. This is way easier to say than to do, but it is truly so important in anything that you do, and in just even your daily life. You'll always run into somebody who needs your help, and it's not easy all the time to fix the problem and fix what they need. Sometimes it takes a little bit of boldness to get it there, and it might feel weird, but do it because it's worth it. That's finding the person throwing people in the river. That's what that is. So my last thing I'll leave you with is my favorite quote from Dr. Seuss's The Lorax: unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So with that, I will take any questions, comments, or complaints. I also put my email up here and a LinkedIn logo just to remind myself to remind you to find me on LinkedIn and connect. I'm a LinkedIn monster, so please do it. I love connecting on there. So yes, I am done. I will quit talking.
Thank you so much. Thank you so much. This was fantastic. I was like, I really want to unmute so she can hear every time I laugh, but then I was like, that would be so distracting. That is fantastic. I will say thank you so much. I do have a feedback form. If those who are still here could please fill out for our office, we would really appreciate it. But does anyone have any questions they'd like to ask? I love your brother said awesome presentation. If that's your brother.
I know, so cute. I'm reading them now. I'm like, wow, great.
Questions? Anyone? If not, I have one because I always.
All right, let's hear it.
No? Okay. Well, so I guess my question was really like, what was now as like a professional in the field, what would be one of your, I don't know, like trying to find the way that I want to word this, like, it's not necessarily advice, right? But like also just thinking like as a professional working with other students, trying to get people to like think about their community in the larger aspect, what would be, something that is still now affecting you and like motivating you and pushing you to do more?
Yeah, that's a great question. I think one, it's finding what you care about. I think it's really easy, to think about service. I know this is a common thing when you think about service learning hours. You're like, oh, I'll just do it in this most convenient place, right? Just to get them out of the way. I strongly would recommend not doing that and find something that you really care about. Because then it doesn't really feel like it's a requirement anymore. I honestly, all of my service learning hours, I totally was not even thinking about them until, turning in the final report for all my service learning hours. But I think that's the key, is finding your tribe, like finding your people. That can be hard to do, but on campus, there's so many student organizations. You have people in your classes. Faculty are a wonderful resource for that. Certainly the Office of Service Learning. But I think just finding that tribe of people that care about what you care about. I can say that in my Global Medical Brigades experience, I unfortunately took for granted so bad how happy I was in that experience, just from interacting with those students that really cared about health, and like we were like, oh, we can do this. I love that environment, and I haven't really found anything like it since. And it's something so valuable. So I think finding that is my main piece of advice. But don't like just do it for convenience. Do it for value.
Thank you.
Yeah.
Rachel, I just want to jump in and say that your talk was amazing. You literally embody everything that we hope students will do. And, we believe in this work for all the same reasons. We just don't have all the experiences, like the real experiences to show people on a plate that you have. So I love that this is literally your plate. Like
It
here's
is
the
my
plate.
plate.
Look at how amazing this plate is, and everyone should eat from this plate. Like, so thank you for presenting, and Jesse, thank you for recording, because we would love to share this plate with others and help them understand just the power of not just service learning, but true community engagement, and really looking at, we preach all the time about the root of an issue versus a Band-Aid. And this is literally that. And story after story, slide after slide, you depicted that again and again and again. So thank you for the choices you've made in life, and thank you for sharing those choices with everyone else.
Thank you.
Your
Yeah,
parents are also like, I mean, your whole family, you all are just amazing.
Aren't they the best? Yeah, I totally have to agree with you on that one. When I was making this presentation, I was like, oh my gosh, I remember, like all of the feelings came back to like how passionate, like that you are in the moment of these certain experiences. And then you slowly, like you have to zoom all the way out to be able to see how they connect. Right, I certainly wasn't making the connection between like Nicaragua's water quality with like my well water thing. Like I was not making the connection at the time. I was just like, oh, like that kind of makes me think about this, and that makes me think about this. But having the opportunity to zoom out and kind of connect all the pieces is such a valuable thing. And there really is a timeline, which I think is really cool.
Well, and I love that your family is literally driving around spotting grocery stores and making comments. And you said that, and I'm like, I should do that with my 4-year-old, because we should start this early. Like
I have to tell you a little bit about that. So we were in Dayton, Ohio. My brother goes to college up there for his MBA program, and we were up there, and we're killing time before he gets off of soccer practice. So we're driving around, and I am in the back seat, and my parents are in the front, and I'm just like, has anyone seen a grocery store? And then I've been watching for like 5 minutes, and I haven't seen one grocery store. And I'm just like, am I missing something? And so then I say it, and now my mom and my dad are like, that might be one. And we're like, no, that's a 7-Eleven. Like, oh, that might be one. No, that's a Mediterranean, like convenience store. And so we're slowly realizing like, there's no grocery stores. So Wayne, my brother, gets in the car, and then my whole family is like, Wayne, like, see if you can find a grocery store. Like, we can't find any grocery stores. This is a problem. And we're seeing like pizza places, like tattoo parlors, smoke shops, like KFCs, Taco Bell, all of those, not a single grocery store. And so from there, it has been, my brother actually declared his concentration in his MBA program in healthcare management, simply because of that family experience of being like, yeah, why is that? Why does that exist? So I think also, Jesse, to answer your original question, is like finding those weirdo things and saying, why the heck is that happening? Right? So who is throwing people in the river? Why is that happening?
That's it.
That's great. Well,
Logan, I saw that you had a question.
Yes, I've got a couple.
Okay.
So how about first one, what's a connection that Lee Health has to FGCU? Are there opportunities that you do community partnership directly with FGCU? We'll start there.
Yeah, so interesting question. This is an evolving thing. So Lee Health and FGCU have always kind of been connected just as like large entities in the region. We do several sponsorships that cover like FGCU scholarships and things like that. Certainly we have a lot of FGCU volunteers, and correct me if I'm wrong, I think you're a scribe, right?
Yep, I do, yep.
Okay, yeah, so there's that. Recently, so I started teaching my class in the fall for health disparities. And from that, we got an offer from our leadership for FGCU internships and health disparities. Like huge nice. Deal. So I think like there's those opportunities that are limited for now. We're gonna pilot that coming soon. But I think from there, we've realized that we have a really awesome pipeline of students that are interested in community health, and even just, forget health, just about being engaged in your community. And so I think that's growing. That's a potential opportunity.
Awesome.
Yeah.
I have another one. So if you were to go back to Global Medical Brigades now, how would you further that relationship with Immokalee if you had the role of president at GMB again?
I love that question. I think about that a lot.
Just picking your brain.
Yeah, I like that. So here's my thought, and this has been my thought for a while. I would like to leverage the FSU medical residency program that's located in Immokalee and see what they're doing. I know that they're doing really incredible stuff, but maybe linking up with them is an opportunity to further service learning opportunities, or some kind of linked Global Medical Brigades and FSU medical residency program, like kind of service. I remember when we were doing the Immokalee Latino Health Project, we had several community members come into our clinic not truly understanding what it was, and they were in tears begging us for a refill of their prescription that they couldn't go anywhere. They're like, I don't know where to go. I don't know what to do. I need help. Look at this thing on my arm, like all of these things. And we were like, we don't know where to go. So of course we had to figure it out. And there's certain clinics out there that do help. But the awareness of those resources are limited. So I think I would also try to do something with awareness, maybe connecting with the Coalition of Immokalee Workers or the Immokalee Foundation. They're very connected in Immokalee Foundation, more so with the youth, and then Coalition of Immokalee Workers, obviously with the migrant farm workers. So I would connect in there, because I think you got like the migrant farm workers and the youth. You have like the whole spectrum. I think working with those two groups would be really powerful.
So I love this so much because my friend Melanie, she actually we did our undergrad together here at FGCU, works as the outreach in the outreach and advising for the Florida State University, like College of Medicine. So I went ahead and put her contact information in the chat, because she would be fantastic to work with in terms of getting that connection.
Thank you.
That's great.
Awesome. I had a quick fun question, Rachel.
Okay.
So the first time I met you was the Immokalee trip, right? So you had 3 trigger words, right?
Oh my gosh.
Remember what the 3 trigger words were?
I know it. Okay. Gentrification is one of them. Free market solutions is another one. Hold on. I'm going to know it. Gentrification. Can you give me a hint? Do you know the last one?
I think I do.
Oh, what is the last one?
Is it corporate social responsibility?
No, that wasn't it, but that sounds like something it would be.
Oh.
You know what's funny? I definitely have it in my phone somewhere. I absolutely do remember that the 3 takeaways from our Immokalee immersion trip were the words gentrification, free market solutions, and then one other thing. I love that you remember that. I'm glad that sticks.
That's so funny.
Oh, well, this is fantastic. Rachel, I mean, like this, again, just to echo what Justin was saying, like this is exactly what we're trying to get through with students is finding some of those root issues so we can really make some great things. Nora just asked, do you think free market will have the solutions?
Oh my gosh, Dr. Demers knows my pressure points. I struggle with this, Dr. Demers. I have changed. I really struggle with the free market solutions now, especially since COVID. And with simply just another example is the Texas emergencies that we're seeing right now. It's kind of insane. I think in the Immokalee immersion experience, we saw a lot of problems with the way that Immokalee is currently structured. They don't really have government support out there, but they do have wonderful support from their nonprofit organizations, the Immokalee Foundation, Guadalupe Center, Coalition for Immokalee Workers. Like they have all of these really wonderful organizations. So I think that's what I was definitely trying to get from there. But I love that you asked the question, because I'm certainly very touchy on the subject now. I could probably go either way.
I love this. So thank you all again so much, Rachel. This was fantastic. We really appreciate you and all the advice and everything that you've shared today. So thank you. Thank you so much.
Thank you.
Absolutely. Well, everyone, I hope you have a fantastic night. Thanks again for coming. We really appreciate it. And I'm going to stop the recording.